Okay, well, we're right at the 12 o'clock Central hour, so we'll go ahead and begin our webinar program for today. Welcome to all of you, and thank you for attending our open forum on patient safety and risk management for federally qualified health centers. My name is Tom Piotrowski. I'm the Executive Director for Clarity's PSO program and Vice President of Clinical Operations here at Clarity, and I'll be the moderator for today's open forum. And just by way of housekeeping for today, this webinar session is going to be recorded. We will have 3 guest speakers joining us from their health centers and talking a little bit about patient safety and risk management successes and success stories that they have experienced. And we'll have a chance for some question and answer at the end of the session. And we'll have plenty of time for that. So on the right-hand side of your GoToMeeting screen, you should see a little chat function there. If you wouldn't mind just typing in your questions there, and then we can submit those questions to either myself or our 3 panelist speakers, and we'll have plenty of time to answer all of those questions towards the end of the program. So once again, thank you for attending today's session, and I'll be the first speaker for today, just rounding out, a little bit about who Clarity is and what you can expect from today's program, and then about midway through, we'll give an introduction to our 3 speakers, and we'll have a chance for you all to hear some stories about safety event reporting, and some data analytics as it relates to health centers to give us a sense of what's happening in health centers. And so as you're asking questions to us or to our panelists, this really is intended to be as open about patient safety as we can be. So what sort of barriers and challenges are we all facing? And we'll post some of those questions for you throughout the webinar today. And this is the first of a series of forums that we're presenting, particularly as it relates to the health center environment and what's happening in this community. So if you would be so kind as to be as open-minded, challenging yourselves, challenging us with the issues of patient safety and general safety culture as it relates to health centers. That is our goal. That is our mission for these forums going forward. By way of company introduction, a little bit about Clarity, and we'll go through the first few slides here briefly, so we can really get into the meat of today's webinar. Clarity Group was founded in 2002, and it really is at the center of healthcare risk, quality, and safety. We provide healthcare services to all different types of healthcare providers. We certainly are specializing in offerings and services for health centers. And it's really 3 services that we offer: the Healthcare Safety Zone Reporting System, which is a total and complete online event reporting system to help you manage all different aspects of safety and environmental issues and workflow issues in your health centers. We also operate a patient safety organization, which is an avenue to do different types of safety analytics and aggregate reviews and comparative types of analytics. And of course, risk quality safety consulting, which is really about risk management reviews and proactive risk assessments and so forth. So all the services that we do really are pointed at how do we prevent error from reaching our patients? How do we create a harm-free healthcare delivery system wherever patients are? And that's really our focus. And so as we deliver those focuses, we really look at the core of things. Our foundation is about improving services to patients. It's about reduction in harm. How do we evaluate what that harm is by way of data analytics, safety culture and the environment? What are our leaders doing? What sorts of supports can we leverage? And probably most importantly, so things like this open forum environment and other environments, how do we share and promote evidence-based practice? I know that's probably a term that's a little bit overused, but what we find when we're doing risk and quality and safety projects and consulting is that there is a ton of great thinking from our clients and from you all and from your communities. How do we share that information so we can identify where are our best practices, and equally important, where are our opportunities? So we're very proud to be working with many federally qualified health centers across the country to offer a variety of risk quality safety services. I think you'll find a unique focus today on data capture, data collection, and then how that data is used to drive improvements. And I hope you see that today, and that's really what we're looking to share with you. So some information about FQHCs and health centers. I believe many of you probably know this, but I thought this slide was very interesting. It was recently updated by HRSA, and it just highlights some of the environment. And if you look at that top there, that 27 million people, if you go back in time to, say, 2008, 2009, that number was about 16 to 18 million people. And so health centers have grown the patient population across the country that we're serving by nearly 1 million people every year for the last 10 years. And we think that trend is going to do nothing but continue and to grow. And so it's our goal, our mission, to look at how can we put in the right supports to make sure that health centers can manage all those patients and manage them safely with the right resources and the right support. So focusing on risk, quality, safety, key areas, reducing the risk of exposure for potential medical malpractice. Now, we know that the Tort Claims Act helps, but there are some gaps. If we can really close those gaps and be very solid with quality assurance and proactively reducing risk, that's really what we intend to focus on going forward. Credentialing of staff, very important. That's a big part of data capture and dotting the I's, crossing the T's in terms of the right providers in the right places, taking care of the right patients. Identifying problems quickly, so an enterprise approach. For those of you who have many centers, it's going to be really important to see this, the broad brush across the organization, and then importantly, being able to very quickly respond to those. So having the right systems, having the right tools in place to be able to do that is going to be critical. Capturing patient information, tracking patient concerns. So whether those concerns come from visitors, patients themselves, or staff, how do we identify what the patients are telling us about safety, about risks, about concerns? and the ability to identify, and this is really where the analytics part comes in for risk, quality, and safety services, and being able to hone in and drill into areas specific for you. And as we get through these next few slides and we introduce our panelists for today, it's about the specificity of what you all are dealing with, whether it's medication issues, whether it's diagnostic issues, responses to patient infection control, HIPAA, employee safety, all those different specific areas of concern. How do you identify them? How do you identify the right data that addresses how safely we're measuring each of these categories? That's the focus here when we're talking about risk, quality, safety for our health centers. Excuse me. So as an example, in the next couple slides, I really wanted to as a way to get us thinking about asking ourselves and our panelists some questions. How do we think about all of this stuff and the uniform data system in the context of patient safety? And I just wanted to point out a few examples here to really start to ask ourselves some questions. So in the UDFs, there are questions, and I know this was recently updated for us, but in the context of patient safety, there are some areas that are starting to ask us about this. So for example, how do you collect data for clinical reporting? And notice one of the options there is, yes, of course we have EHR, but it's in combination with other systems. And those other systems are hopefully capturing safety data. Another question here is, how does your health center utilize health IT and EHR data beyond direct patient care? So again, looking at this from the context of patient safety. And so even from the UDS, which we know we all are doing, there are many areas that are directly pointing us and trying to get us to think about not just the clinical data capture, the EHR, the things we're required to capture, but what else? How do you start to connect those things together to improve the safety of care delivery? Here's another example, and of course this is just a screenshot of UDS reporting and how you do that. But from the data that's inputted into those systems, we are able to capture and identify metrics. And so on the right-hand side, there are a couple of text boxes. It's a good example. And one very good example that we should all be proud of, that health center patients who come to our centers for hypertensive care have a 63% rate of controlled blood pressure as compared to national averages, which is largely, CMS data, at a rate of 57%. So we're outperforming national metrics as it relates to normotensive or controlling blood pressure in hypertensive patients. Here's the question, and again, in the context of patient safety. how do we account for safety practices? So if you take that 63%, of that 63%, how do we measure, how do we account for if there is a dosing error? How do we account for if there is wrong medication to the wrong patient? Or with the 37% that were non-compliant, were there safety issues related to the non-compliance of us raising from 63% to 70, to 80, to 90%? How do we account for those safety practices? So here are some of the questions that we want you to think about, again, in the context of patient safety. How do you measure and track defects? How do you know you've successfully implemented a new process? It's one thing to have great ideas, and we all do. But when you implement something new, do you think about how this is going to affect the entire organization? And how are you going to monitor? And how are you going to measure success? And how do you leverage sustainability? Where does that data come from? Is it just EMR data? Do you have other systems like a healthcare safety zone product where you can capture safety event reporting across the system, across the enterprise? Where does your data come from? And personally, one of my favorites is, how do you compare your successes with other providers? And so if you have opportunities to do comparative, if you have opportunities to participate in open forums like this, how do we share what we're learning with and from each other? And I think these are all the questions that are embedded into today's open forum and future open forums in terms of, in the context of patient safety, health centers in the context of patient safety. I wanted to share with you some very specific examples of what we heard. So some of our homework, if you will, before today's webinar was to reach out to a number of health centers who are our clients. And in the full context of transparency today, the three panelists who you'll be hearing from are Clarity clients. They are using our products to drive their safety initiatives. And those folks, along with others, these are the stories that we've heard. These are the kinds of things that our clients are collecting. This is the kind of data that our clients are collecting, and other types of information. And probably you all have either experienced or are trying to collect or are actively collecting this sort of information as it relates to safety topics in health centers. So whether it's employee safety, whether it's the entire medication administration process, including vaccination compliance, or dental safety, or infection control, or environmental safety, I'll just continue on here, or in terms of workflow, in terms of human resources, or other types of maintenance reporting requests and so forth. HIPAA documentation, patient aggression, behavioral types of issues. And again, I know that, I'm probably preaching to the choir here in terms of, you either are experiencing or have maybe tackled some of these issues, but these are the safety topics that are fairly prevalent in health centers today. And so these are the kinds of things that you'll hear our panelists talk about today. We hope that you're able to think about these things in terms of how you're handling these issues, and maybe ask our panelists and yourselves some questions about what we can do to advance safety in these areas. So here are our goals for today. Now, from the provider's perspective, we would like to identify the need for patient safety interventions, looking at things from a wide lens across your organization. How do you choose where you should spend your time focusing on patient safety initiatives? What is the impact of that safety initiative? So this is what we're going to talk about and have you talk about and think about analytics, using your data to drive safety, to identify when you've been able to make an impact, what that impact has been, and how wide that impact has been. So the third part there, then the ability to track and trend data, to make that change, and then to see that change sustained. So things like monitoring, things like surveillance, things like continued improvement. These are all the things that we hope you're thinking about as you hear from our panelists today, and hopefully you have additional ideas and questions that you can bring forward as well. Okay, without further ado then, we have the privilege of introducing three panelists. We'll introduce them individually, and then after their introduction, they'll have a chance to talk with you, and you'll hear from them with respect to one or two of the safety topics that we've talked about previously from their perspective in terms of what they have learned through using the healthcare safety zone to capture data and then to improve on a safety initiative. So I have the honor of introducing our panelists. Our first panelist is Jill Adkins from Southwest Virginia Health System. Jill has served as a risk management and compliance officer for Lincoln Primary Healthcare across all 17 centers in the state of West Virginia. Jill has been the clinical coordinator for labor and delivery units. She's also worked as clinical systems analyst with a focus on development maintenance of hospitals' EHR system, and has also worked as an RN case manager for the hospitals team. And I think that many of us will have many hats, and you'll see our speakers are similar here in that there's many roles, and so there's lots of experience and lots of different viewpoints in terms of their experience in working with health centers. So Jill will be our first speaker today, and I believe that Jill is going to talk about a couple of topics that relate to safety rounds, maintenance reporting, as some of her success stories. So Jill, I'll turn it over to you.
Okay, great. How's everybody doing today?
Great.
All right. Well, a couple of things. I know there were some questions that some interest in the HR forms. That was one thing that we did include into our healthcare safety zone. The HR form that we developed, the purpose of it was partly to help us track turnover rates to see how often we're having to post a position. We use it to put in any kind of new positions or job descriptions that we've, have added to our organization. And we've also used it to track complaints with employees as well. So when we're doing evaluations, I can run a report based on if there's any complaints for that specific employee, and we can kind of track if there's any kind of behavioral issues that we need to address. As far as with safety, I incorporated an environmental safety round form in Clarity, or healthcare safety zone, and I use that as I go to all the different facilities, and I'm looking for all the different, the different things, anywhere from the facility issues such as lighting or flooring or ceiling tiles, and I also use it for safety. I use it to track to make sure all of our medications that are out, is there any expired medications? Is everything locked up the way it's supposed to be? Has our crash cart been checked the way it's supposed to be? And so I look for all of those types of things, and I use that in a couple of different ways. I use it as an educational opportunity as I'm doing rounds to go over that with staff, but I enter that information into the healthcare safety zone to track issues that I found in my rounding, and then I can run reports off of that and to make sure that everything's been corrected. From there, any issues that I found that require some maintenance follow-up, we also have our maintenance added into this program as well, and so I enter in a maintenance request to make sure that they are aware of the issue that I have found, and I can track that to make sure that it's been taken care of and corrected. So I do run a maintenance report weekly for our staff to make sure that everything's been addressed, that we needed to, fire extinguishers, you name it, we have it in the system. So we use it to kind of make sure that everything is up to date and there's not any kind of safety issues that hasn't been taken care of. Trying to think what else that we've used this for. The maintenance part, we also included in our maintenance part medical supplies and any problems with medical equipment. So the staff also enters in orders or requests of any kind of medical equipment that needs repaired or replaced, or maybe some new items that we might need as well. So we also use that as a tracking mechanism, and it allows our managers to also get approval, because this goes to all of our senior leadership staff. So if there's they need approval for a piece of equipment, then our senior leadership can communicate through Clarity with that to give them the permission to go ahead and order what they need. I know that was a lot in a short amount of time.
Yeah. No, that's wonderful. Thank you, Jill. And I think one of the interesting things about Jill's examples here is, while her organization captures the more routine types of, event reports like a medication issue or, a follow-up issue, she has used the system in her organization to capture some of the more perhaps difficult things or more operational or more workflow things. And so just think about that. How are you using your systems, not just to capture event reporting, but other types of things? Environment of care, safety rounds, maintenance rounds, all those sorts of things. It's nice to have all that data in one place so you can query it at any time, and then you maybe tie it to other aspects of infection control or security or maintenance and those sorts of things. So I think those are great examples because it's nice to have a place to capture all that stuff in one place. So thank you for that, Jill. Just as a way of housekeeping, again, we'll save all the questions towards the end. So I see a few questions coming in here, so that's great that they're in here already. We'll introduce our next two speakers. We'll hear from them, and again, we'll have plenty of time for Q&A towards the end. So thank you, Joe. Okay, our next speaker is Trey Fletcher, and Trey is from the Healthcare Network of South Florida. He is the general counsel there, and you'll see again as another person who wears multiple hats, but his work includes general counsel for the Healthcare Network, as well as work with the Ronald McDonald Care Mobile and the Health and Smiles mobile programs. In his role, he oversees risk management, human resources, health information management, as well as, of course, the legal affairs. So we welcome Trey, and Trey is going to talk with us a little bit about employee safety and I believe needle sticks as it relates to our safety topics. So Trey, I'll turn it over to you.
Thank you very much, and thank everybody for giving me the opportunity to speak today. As an FQHC, I imagine many of us started in the same way. I know that when my organization began in 1977, we started in a trailer, and you could raise your voice and talk to the person next to you, and we had less than 10 employees. As time has changed, we've grown to be an organization of over or right under 400 total employees, and one of the biggest changes, among the many, is when it comes to employee safety. So when we started, it's much easier to have one designated employee health nurse who, if there are any workplace injuries or there are any issues, you walk across the hall, to now an organization that has 21 locations spread throughout Collier County in Florida. And when I came onto the organization, we were still using pen and paper and an email system to report employee injuries, and that created situations where sometimes an email would be missed, or somebody be out, or the wrong person would receive the incident report or the employee injury, and action couldn't be taken quickly. What we ended up doing is utilizing the Safety Zone portal for all of our employee events. We also use it for the rest of our risk management events, but one of our big focuses was on employee safety. So now I have a system that anytime an employee is injured in any way, our staff knows to go immediately into the system, enter in all the data, and the system itself automatically emails my HR department, our designated employee health nurse, and the other relevant folks so that we can get things taken care of in a really timely fashion. For knee sprains and ankle injuries and things like that, the quickness that we can get it resolved isn't as important, but my organization is also a Ryan White grantee, so we see both in dental and our medical side. We're a provider for a lot of our HIV positive or AIDS patients. So, the quicker that we can start our process and get the appropriate individuals notified, the easier it is on the patient so that we can get testing done, and the easier it is on an employee who might have potential fears about transmission and things like that. So we really have revolutionized the way that we do our employee safety program and the tracking of it. It also used to take me a day or two to run reports to report to my board, because we all have to make risk management reports on a quarterly basis for Federal Tort Claims Act purposes, and do an annual one now. Now I can run reports and I don't have to spend an entire day of my time to identify areas where I might be having issues with employee safety. One of the most important of those areas is with our needle sticks. They're frightening. I've learned now that they're almost impossible to avoid. We do everything we can. We work with a workers' comp carrier, but one thing that we noticed as an organization prior to implementing the safety zone portal is we'd get reports for a puncture, and it just automatically folks would consider a needle stick. So, we replaced needles, we did a lot of training on proper handling of vaccines and things like that. Well, we implemented the safety zone portal, and over time, because of the different categories that are required for reports, it became apparent that our main issue for the organization wasn't, vaccinations and things like that when it came to needle sticks. It actually ended up being our dental burrs. So while we had previously talked to folks about sharps handling and things like that, we then learned that we really needed to focus on the sterilization of dental equipment. So when folks are loading a sterilizer, making sure they're holding burrs properly. When they're finishing up treatment with a patient, that they are using proper safety techniques when removing a burr. Or we've had to do training on ensuring that your burr is no longer spinning. If you work in risk management for long enough, you'll really see just about everything under the sun happen. And what this has done for the organization, and this isn't just related to employee safety, it also has a lot to do with how we handle our employee health program and things like that. But we have moved our mod. We were close to being, I believe when I started with the organization, we were above a 1, and now we float around 0.8 as our mod. So, we have great outcomes both for employees because folks don't have to worry about whether or not they're going to be taken care of in a timely fashion. But we also have the added benefit of being able to track and work with our workers' comp carrier and identify areas that we are lacking so that we can get our mod down. I don't know who on the call, if everybody on the call is part of the insurance purchasing process of the organization, but your mod helps to decide how much you're actually going to pay for your workers' comp care coverage. So the lower your mod is, 1 is average, the better off your organization is because you save money. So it's really taken our organization's ability to report and track and find issues to the next level. And at the end of the day, it also provides a system that I'm going out of town next week. I have other people that I've added to the analysis section and other folks who are trained within the organization that if I'm not here, while I'm still the primary contact, we have the availability to have backup. And it's not just a locked filing cabinet with a ton of paper in it that only one person is aware of how it's used and it's set up.
Perfect. Great. Thank you, Trey. Great use of data. Appreciate the stories there and the added history of starting very, very small and growing and the need for that enterprise look. So very much appreciated there. Okay, great. Okay,
thank you.
We have one more speaker to speak with us, and then we'll open up for questions. I have a few here already again, so this is great. And then, again, on the right-hand side of your screen, you'll see the little chat function there. If you have questions, additional questions, just go ahead and type those in, submit those to me, and then we'll propose those to our panelists. Okay, our third and final panelist for today is Lisa Saunders, and she is from Rocking Horse Community Health Center, and they're in Ohio, and there she has been a clinician in the pediatric area for a number of years and is also serving as quality assurance coordinator for the immediate past 4 years. In her roles, lots of different roles again, she oversees a variety of quality initiatives as well as the safety officer, risk management, infection control, and the data steward for UDS reporting for all of her locations and all the service lines. And so we welcome Lisa. Lisa is going to speak with us as it relates to patient aggression behaviors and HIPAA documentation. So Lisa, I'll turn it over to you.
Thank you. Good afternoon, everybody. Thanks for giving me the opportunity to speak today. So I'm just going to kind of take you back in history of how we got involved with Clarity in the healthcare safety zone and then talk about how we use it. So going back to about 2016, we were actually using paper incident reports across the organization filling all that information out, throwing them in a binder. Once a quarter, we try to, trend those out and see where our highly reported areas were, and then, try to come up with the identification of where we were going to work for quality improvement. It's very time consuming, very tedious. So we came across Clarity, I think, through another webinar, probably just like yourselves. Somebody put the information out there, and then I found it and was like, this is exactly what we need. So we adopted Clarity in September of 2016 and started using the healthcare safety zone. Setup and customization was great. We had great support. We were able to customize it to show our specific locations down to, sub areas, categories that were specific to us, which was very helpful. We had our IT department push that link out to everyone's favorites on their Internet Explorer so that we could train staff to know how to submit, where to go, the importance of submitting. We did a lunch and learn to familiarize all of our staff with that process, and then we went live with the system in November of 2016. Through that, just continuous monitoring, follow-up, using the reporting system to be able to identify the trends and areas where we needed to focus on, and then really trying to develop or create that non-punitive, leadership-informed culture in our organization. We really needed all hands in. If we don't know about it, we can't fix it. And this was our way to really get staff involved and say, put anything and everything in there so we can hear about it. You often hear your staff saying, this has happened a million times. It's so frustrating with any type of incident. If we don't know about it, we can't help fix it. So this was a great tool. The benefits are, of course, you can build it to automatically notify your supervisors and your staff to get notifications once somebody has put that incident into the system so that there can be the follow-up and that trail of documentation. Of course, trending and reporting abilities, which I myself feel like I've just hit the tip of that, so I really am going to dig into that. That's one of my projects after this webinar, is to really utilize the reporting a little bit better for our organization. Ease of use, it's step by step. There's hard stops that can be built in so that people can't skip areas within that. And just like I said, the implementation was pretty easy. So once we started using the tool, we instantly noticed two trends that were being reported within that first year. One was an increase of reports related to patient aggression, behavior, violence from patients or visitors, as well as decrease in employee comfort with handling these scenarios and concerns about their safety, so employee safety overall. Around this time, just like the rest of the nation, our community became more aware of our opioid epidemic in the community. And we had enforced a lot of controlled substance protocols that included substance agreements, substance control agreements, frequent orders checks, stricter prescribing policies, random urine drug screens. And so we were seeing increased incidents. Patients were not happy with this process. And we had some concerns. We had some desktops thrown. We've had some major things happen. So real safety concerns. And then that, of course, came from the staff in some of the incidents reported. They wanted security guards. They wanted to discharge patients. They wanted stricter rules and more training on how to handle this. So we knew we had to do something different. Our director of nursing, who wasn't able to be on the call today, her name's Teresa Hawkett, she discovered and championed an initiative called CPI training for our staff, which is crisis prevention intervention training. A lot of the healthcare industry has used this as a way to equip their staff in prevention strategies, de-escalating skills, and just personal safety. So this program was awesome for us. We sent 5 employees out to get trained and kind of train the trainer style. They came back and in turn trained all of our staff internally. We're an organization of about 180 employees, so it took some time. We broke it down into 10 to 15 individuals in each training session, and it was a full 8-day training, or 8-hour training. We worked through scenarios, verbally nonviolent de-escalation of the behavior, and now all of our staff are better equipped, and we've kept this up on an annual basis where they get a 2-hour recertification every 2 years. In addition to that, we decided that we needed to do a little bit more looking at the data of how that affected everything. So we pulled some numbers from Clarity and the healthcare safety zone. In 2017, when we first started using this and we noticed the trend upwards, we had 63 submissions that year for inappropriate behavior with patients and visitors. In 2018, after the training had been done with CPI, we had 47 submissions. So that was about a decrease overall of 16% from 2017 to 2018. And then in 2019 so far, we've only had 6 submissions of that. So we really feel like that training and being able to get the data from the system, identify the need, put something in place, really helped and was effective with that. You know, we were pleased with that, but we decided we needed to do a little bit more as well with safety of our employees and making sure that they felt heard and seen. So we initiated an incident review committee or patient review committee. It meets monthly if there are incidents to review. And what this is any incidents that has been submitted for aggression, behavior, violence. We have several delegates from across the organization, different disciplines, different departments come together and review those. Someone is typically assigned to do a little bit of research on that specific patient to see if there's a history in Clarity that we've reported on them in the past and they've had additional behavioral concerns, as well as maybe a chart scrub to see if there's any telephone calls or any incidents in the past that would be relevant to the situation. We sit down, we review, we discuss, and then we try to come up with a combined solution. Some of those solutions may include a phone call or a personal meeting with that individual to explain that they're receiving a verbal warning based on their behavior, that it's not acceptable. We will respect them and they will respect us. A lot of times this is maybe done by a supervisor, a member of our behavioral health staff, or CEO, CMO, whoever is the most appropriate person to address this patient. Additionally, we came up with a behavioral contract, an actual paper that we'll sit down and talk to a patient about if we feel like that's the solution, and we have them sign off that their behavior has to change in order to continue care. Or maybe we identify that we did something wrong and we need to train our staff or use it as a teachable moment to say, hey, maybe we could have handled this differently, and that's the approach that we take with that incident. The last resort, of course, would be to discharge a patient from our practice. That used to be the go-to answer from everyone at one time, but it's not that way. I mean, we are, as you know, FQHCs, the safety net for our patients, and a lot of times the last resort for them. So we really don't want to turn anyone away. It has to be some pretty aggressive and repetitive behavior to be able to do that. If an agreement can't be made with that committee, then the CEO and CMO will be pulled in to hear everyone's side of the story, the whole detail, and then make a final decision off of that. One additional committee that we created off of this is also the safety committee, and that's been going on for about a little over 2 years now. And this is, again, an additional group of disciplines and department representatives that come together to hear various safety concerns. And so out of this, in the last 2 years, things that we've done with that group are creating, our lobbies used to be completely open to the back clinical area, and a concern was that they really wanted some safety and some security there. So a door was implemented with a badge access system. More lighting in the parking lots was implemented for safety concerns. Surveillance cameras at entrances and exits were put up. And then we talk about various things in there, like how are we going to do our fire drill, like real safety concerns. How are we going to do it with patients here? Are we going to do it not with patients here? So all those things came out of seeing the concerns initially from the healthcare safety zone. A side note, or a second area that we've used this for that's pretty easy and pretty simple is that, as a healthcare center, that HHS requires health centers to report HIPPA breaches as they're discovered, or at a minimum of annually if it's under 500 individuals. And so typically what we're doing is we're scrounging at that point of reporting for the year to say, where's all this information? You know, it's in this binder, it's in this filing cabinet. With it all being in the healthcare safety zone, we were able to pull a report of anything that was HIPAA related, sit down with our HIPAA compliance officer and members of leadership to determine what truly needs to be reported. And we had all the detail right there to go onto the HHS website and report that information. So very, very time consuming. The other way, time saver with the system. I think that's all I had. Thank you.
Wonderful. Thank you. Thank you, Lisa. And actually, thank you to all three of our panelists for today. We wanted to try to provide you all with, you know, everybody's going to do this a little differently, but also there's some commonality in terms of some of the items and issues that we all have to tackle. So very much appreciated for the three of you speaking with us today. We do have some questions that have come in. And as I mentioned, we would have time for some Q&A. So there's a couple of questions that have come in that are probably more geared towards all three of you. And so I'll ask the first question here, which relates to safety culture. And I believe, Lisa, in your last couple of remarks there, you were starting to touch on this. So sorry if this is a little bit repeat for you. But for all three of you, and that is, what about feedback for staff who report? And I'll just add a little more flavor there. And I think the question is getting at, when you want to increase reporting, increasing in reporting isn't necessarily a bad thing, right? We want people to tell us what's happening, just as we've heard our speakers say. So in your organizations, and then I can speak generally about Clarity and what we experience with our other health centers and other clients, giving staff feedback and having them understand and see what's happening through the organization. So again, using the healthcare safety zone, using the data, and they're analyzing the data, giving it back to the organization in meaningful, useful ways. We're hearing that that's what you folks have done. So the question is related to, do you have techniques or ways in which you are able to provide feedback to staff to support that safety culture? And so that's a question for all three of you. If you know, maybe Lisa, we'll start with you. We'll work backwards. Lisa, Trey, and then Jill, in terms of safety culture, staff feedback reporting.
Yeah, sure. This is Lisa. We definitely, you know, take all of that data that we've trended out of the system and report that on a quarterly basis at an internal quality committee, which is representatives across the board. We also have a board quality and a board that we also do quarterly and annually update to. But really, it goes back to the person that submitted the incident. Of course, there's a tree of notifications that goes out within the system to those that need to follow up. So supervisors, HR, quality, safety officers, whoever needs to be involved, we kind of built that structure behind the scenes. They get the notification and can do the follow-up, maybe reach out to patients, maybe research, maybe do an investigation. They're documenting all of that in the system, and then there should be communication back to the reporter to give them what they need. They might not get all the details, of course, if it's an employee-related investigation or something of that nature, but they will know that there has been follow-up and closure on that. So, you know, definitely.
Great. Thank you. Thank you. And Trey and Jill, any additional comments you'd like to chime in on?
This is Trey Fletcher. You know, one of the biggest things with safety culture for us is trying to support staff in their current jobs. And one of the big things that I pushed for when we decided to move to a different system, or what was requested, was please don't make this take more time than what we're currently doing. And as much as, you know, we drill about the importance of safety, and we really try and get that message out, you know, a lot of what we've found is successful is making things easier. So making being safe and making safety part of the job easier is really paid dividends for us as an organization.
Great. Thank you. And Jill?
I would agree. We kind of do this pretty much the same thing. I do the follow-up with whoever has submitted the request or the incident or safety concern. We also put in our system a employee suggestion form, And we use that for safety as well. So if there's a safety concern that they've identified or they think that might potentially put us at risk for, a breach of confidentiality, for instance, they fill out that form and give us suggestions on how they think that this could be improved or better, because we have 17 locations and, they're the ones who's out there working every day. So we wanted their input on that as well. So that kind of helps us catch things ahead of time before we actually run into any kind of problems.
Great. Thank you. Trey, I believe this next question was directed towards you because it was submitted while you were speaking, but it'll certainly, I think, be applicable for all three of our speakers today. The question is in relation to drill downs and the ability to quickly drill down into data, and I think that's getting at how the system helps you do that. So your example of you started with a puncture, which is a higher level category, and then so the question is how easy is it for you all to drill down into getting specific analytics? And that's, I think, what you started to describe was it started out at a higher level and you were able to drill down very specifically to where your problem issue was and identifying the data that way and then working backwards towards solutions. So I think you kind of spoke of that, but if there's anything additional you'd like to add there in terms of your abilities to drill down in the system and identify the data that's going to help you tell that story, how easy is that for you all to do?
I'd say in the thing, and again, this goes back to what I previously said about the ease of doing something. Previously, I think like a lot of us currently are or were previously on paper. So when somebody was reporting an incident, they had a blank area to write in what it was. We had suggestions and things like that. So I could have anything from, a needle stick could be anything from a puncture to a stab wound to, a number of different things. And what's different is here in the Clarity system, the way we're set up, is there is a free text zone for full description, but there's also categorization. So it forces folks to choose, from a set of choices, and that's how we're able to drill down. So I can, instead of having to go through and reconcile, 3 or 4 different synonyms for, the same action, I have a set number of items, and I can look at a report and run it out of the system really quickly to see, what locations and what types of events I'm getting. And then I can go so far as to, read through the specific reports, and it's easy to find those.
Great. Thank you for that, Trey. Jill, Lisa, anything to add from your perspectives in terms of data drill downs?
No, I think he nailed it well.
Okay, great. Okay, we have another question here. Again, this is a general question, so maybe we'll work in reverse order this time. We'll start with Jill and then Trey and then Lisa. Do you see other aspects of reporting that may have developed as a result of small successes? And so a pretty large open-ended question there, and I would just say I think this goes back to, if the system is easy to use and if you have kind of a one-stop shop, so people are going to one place to report, you're able to use the data and have success stories. Are you seeing things build from there? So I think that is the question, and so Jill, we'll start with you, and then we'll work backwards there. But again, I'll just repeat the question. So do you see other aspects of reporting that may have developed as a result of small successes? So Jill, I'll start with you.
We have, and a lot of it, like he had mentioned before, just having the specific type of questions for them to, select from, the categories to select from helps narrow that down. And then even in the follow-up, we had specific questions we wanted in our follow-up section. So that's kind of help us drill down a little bit more on that as well. And then just having an option for other kind of helps bring out some other topics that maybe we might have not considered or thought about at the time when we were building everything. And so that's kind of helped us to pull out other areas that maybe we do want to report on and get a little bit more information that way.
Great. Thank you. And Trey, we'll go to you next.
I can tell you probably the simplest thing that we've seen improvement on is my goals for risk management every year, and everybody differs, but for our organization, I focus on increasing the total number of events that are reported while also also decreasing the number of employee injury-related events. And what I've found is that by making things easier and helping staff to identify things like near misses, that if somebody's busy and there's a near miss and nobody else noticed, there is a chance that somebody's just going to overlook it. But by making things easy, folks are more apt to send me the items that really, weren't anything. And it allows us to look at the system as a whole, as opposed to just reporting things that are major issues right then and there. So I've seen increases every year for the last 2 years in the total number of events that are reported to me. And that doesn't mean that my organization is injuring more patients or more stuff is breaking down. It's a large increase in the number of no harm events being reported, which is really important to us.
Yes, for sure. Great, thank you. And Lisa.
Yeah, I think that's important, Trey, as well as getting people to speak up about those near misses is sometimes very difficult. We've done a lot of education with our staff over the last year of putting out some examples through email, through paper, through huddle announcements and staff meetings of, this scenario happens. Is this something that you would report in the incident reporting system or not? To get them really thinking about that. Because there for a while we were only seeing the big issues and we were like, oh, we don't want our number to go up, but we actually have seen the same as well as we've educated and pulled staff and engaged them into the system, that the number of reports are going up, but those major issues have gone down. So that's a good thing to see.
Great. Thank you, folks. So last question, this will be a question from Tom here. It's another general question, but I thought it would be a good way to kind of bring us full circle again in terms of, safety and the context of safety for health centers. And if I could I'll ask each of you the same question here. What's on the horizon? So you look at the improvements you've made through the healthcare safety zone and other data sources that you may have, other safety initiatives you're working on, collaboratives that you're working on, and the communications you have through the community. What's on the horizon? What's next? So if there was a way that you could capture data going forward, if there was a safety initiative, the big challenges, the big barriers going forward with health centers, if I could just ask each of you, what do you see in the near future here? How would you answer that question? And so, Jill, maybe we'll start with you, and then we'll go to Trey, and then we'll go to Lisa, and then we'll have a quick wrap up here.
I'm sorry. So what do I see in the future for things?
Yeah, the horizon of patient safety for health centers.
Try to find the best way to answer that question. Of course, I'm sorry, go ahead.
No, go ahead. I'm sorry to interrupt.
Well, obviously, patient safety is not going anywhere, and we always have to be trying to stay a step ahead as much as we can with things. And using the system has definitely helped us organize things and be able to better prepare ourselves on how to handle it and identify ways to prevent it from happening. So, but we just need to, make sure our staff's well educated on it and try to stay, like I said, a step ahead of everything, so as much as possible that we can, so we can provide a safe environment for our patients. But
okay, perfect. Thank you very much, Joe. Trey, we'll go to you next.
I'd say, in one aspect that I didn't speak to that we use our program for, is we've got a pretty particular way that we track patient complaints utilizing the system. And, it's different in every state. Florida has privatized our Medicaid system and gone to a managed Medicaid system. And, there's a strong focus on HEDIS measures and things like that. But what we are starting to see, and I don't know how in-depth it will be. If I had a crystal ball, I'd be a very fortunate man. But some of these managed Medicaid organizations taking a stronger look at patient complaints and how they're resolved. 3 or 4 years ago, the focus was really on do you have a person who takes complaints, and how many complaints do you receive? And we're starting to see a stronger follow-up now from the organizations or from these managed Medicaid organizations, and really being able to have a place where we know what the resolution was and things like that, especially considering sometimes we won't hear about a complaint from an insurance company for 3 or 4 months, and trying to think back to that incident or how it all worked out can be quite difficult. So we're working on, as an organization, implementing a more robust process for our patient complaints and how we look at them and how our quality department handles them as well.
Great, thank you, Trey. And Lisa, our final chime in for the afternoon here.
Thank you. I think for our organization, just on the horizon for us with patient safety is really just utilizing the tool to its fullest ability. Like I said before, I think that we're just hitting the tip of the iceberg when it comes to reporting and pulling out some of the trends that we want to focus on. So my hope is to just dig into that a little bit more, look at the medication errors, patient aggression. HIPAA is still going to be on that on a quarterly basis, and then running trends. I believe that the system has the ability to kind of do some dashboards. So once you set your area of focus, that you can kind of see what's happening over time, and we just haven't done that to the fullest ability yet. But some ideas just listening to this webinar and other ways that folks are using it that I think we'll dig into in the future is everyone's required to do an annual hazard vulnerability assessment. And we often are trying to pull all the information. How many power outages did we have? How many weather emergencies, did we relocate for? Those type of things. But I really never have thought of this system as using that for those type of reporting and that documentation trail. So I think that's something that we're going to look into here in the next couple of weeks.
Wonderful, wonderful. Well, and thank you for that. That's really the whole goal here of this webinar is to get folks thinking for the health centers community. What are the issues? How are you going to measure that data? How are you going to know it's successful? And how are you going to demonstrate sustainability with an improved safety topic or operational or workflow topic? So thank you for that. And I thank all 3 of our panelists today for giving us some insights into their world and what does safety look like for them, and some success stories in terms of advancing their organizations forward. And that really rounds us out for today in terms of our first of a series of open forums here in terms of patient safety for health centers. And so again, we'd ask you to just think about these things. Hopefully you're able to take some things back to your organization, think about things a little bit differently. How are you measuring? How are you tracking things? Do you have the right tools and systems in place to give you the health center specific data the way you want it, how you want it, so that you can analyze it and use it meaningfully? So we hope you had some takeaways from our webinar today. And with that, on behalf of myself and the Clarity Group, we thank everybody for chiming in and staying with us the whole duration of the hour here for our webinar today. We look forward to seeing you on future webinars. And thank you all